I call the meeting to order. Public Hospital District Number 14, County Board of Commissioners, regular meeting agenda. Thursday, February 13, 2020, 6:30 p.m. Snoqualmie Valley Hospital, North-South Conference Room. Please rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
May the clerk please call the roll of officers.
President Herron,
Here.
Vice President Norris,
Here.
Secretary Hogley,
Here.
Commissioner Spikers,
Here.
and Commissioner Carter.
Here.
Thank you.
Okay, approval of agenda.
I make a motion that we approve the agenda as it's presented.
Second that.
Okay. All those in favor?
Aye.
The ayes have it. Communications. Oh, well, I'm glad to be back. I just wanted to share a few notes or narrative about my trip. So I'm not gonna bore you with too many statistics. I'm just gonna go ahead and read my notes here. I hope I can understand them. I had two trips. One was a medical mission and the other was the World Peace Summit. And the place in Manila, of course, everybody have heard about coronavirus. So that was the challenge for me anyway, for everybody. Otherwise, it was a very productive journey. The 2020 Catanduanes International Association, we call it the CIA, and this is the Catanduanes. It's a province in the Bicol region. It's about 150 miles from Luzon, from Manila. It's one of the poorest islands in the Philippines, and it's sometimes called the typhoon capital of the Philippines, because it's always visited by monsoon. So the only way to get there is by boat or by plane. And when you are stranded in an island, that's the real, you really get stranded for 3 or 4 days until all the transportations are available. So anyway, we started with, the mission started Sunday, January 19, and it ended on Sunday, January 26, with a final critique meeting capping the week's activities. The mission was attended by 260 healthcare professionals of doctors, nurses, hospitalists, physical therapists, pharmacists, social workers, administrators, and non-medical volunteers participating from 7 countries. Services that were provided were pediatrics, OBGYN, minor surgery, dental, ophthalmology, and pharmacy. We also included humanitarian and outreach programs, distributing rice, clothes, shoes, and slippers, school bags and school supplies, toys for tots, and soup kitchen. So the first Sunday, 119, was briefing, assigning volunteers. We sort meds and prep all necessary medical and surgical supplies. And then the rest of the week was working on all areas of healthcare services. I want to thank Commissioner Carter, by the way, for her toy donations. You sure made many children smile, and they were very happy with all the toys they have received, especially those who are in ICU, the children that were, the intensive care unit. So overall, we serve about 3,000 families, not counting those with more than 1 child per family. Well, when we were trying to stop the pediatric during lunch, the doctors would say, count not just the mother or the father, but count the children, because many of them have 5 or 6, and it takes time for them to go through each one of those children. So overall, it was a mission of love, care, and hope for the indigent families living in poverty and hopelessness and no health care insurance. So it was a labor of love. Now, the 2020 World Peace Summit in Seoul, Korea, that was February 1 through the 8th, brings together the global community of peace-loving citizens. And they feature programs from different international associations for peace, like the Summit Council for Peace, Parliamentarians for Peace, Interreligious Association for Peace, the Media Association for Peace, Economic Development for Peace, and Association of First Ladies for Peace, Youth and Students for Peace. The main theme is interdependence, mutual prosperity, and universal values. That's basically that everybody was focused on that. The objective is to help resolve conflicts and discords caused by religion, ethnicity, or nationality. It is a community that transcends national boundaries and is characterized by a new order of cooperative peace grounded in true love and living for the sake of others. The team also seeks to realize peace through cooperation in the areas of politics, economy, ethics, media, academics, culture, and so on. It is a historic summit representing 193 nations of prime ministers, presidents, parliamentarians, heads of state and government, first ladies, religious leaders, and many others. Participants numbered over 10,000 people from every continent: North America, South America, Africa, Europe, Asia, Australia, and Antarctica. It was quite an affirming summit of world leaders' commitment to peace building, bringing a collective experience of wisdom and insight that is essential if we are to successfully build a world of lasting peace through interdependence, mutual prosperity, and universal values. That was what my takeaway for all my trips. So it was very productive, and we hope that we can, resolve some peace and unity and harmony in the world, especially the way our government's working right now. It's operating, and so that's all my trip, and I am having a cold. But I did not get any coronavirus, by the way. Everywhere I go, 90% of the population was wearing masks, maybe 10%. And they come in all shapes and sizes, those masks. Some masks really have some really decorative, things that they put in this. Yeah, so it was quite a journey. It was very memorable, and I'm glad I went because you never know if I ever could attend one more of those peace summits. It's a good opportunity, a life experience, life-affirming experience for all of us if you have a chance to ever. Yeah, and we have our speakers. We have 500 delegates from North America, 300 from the U.S., and I think 100 from Canada and Mexico. And we have, for the U.S. delegates, we have actually Newt Gingrich was one of the keynote speakers. And then we have Neil Bush on the trade and economic development. There are a lot of congressmen and senators in mostly in the DC area, in New York and New Jersey, both Republicans and Democrats. That was a good blend and a good mix. I think we need to hear from all parties and all people in the world that are making decisions for each country. So. And then we also have the United Nations Secretary General, 2017. He's Korean, so he was one of our keynote speakers as well. So there are a lot: President of Guatemala, President of Nigeria, Prime Minister. We were hoping Prime Minister Netanyahu was going to come, could not make it. Send some, yeah. So it's very interesting groups of countries that mix together. And we have several different venues. The venue for North America will be another hotel. Then the European venue will be about 10 miles from the hotel. And the convention holds about over 10,000 delegates. And it's about a mile walk from one room to the next. It's so long. And you are instructed to wear your flat shoes because you're going to do a lot of walking. So I did a lot of exercise. And they were handing out masks whenever you enter, we make sure that and they're also checking to make sure your temperature, you don't have the temperature and all that. So everybody was on their toes to make sure that they stay healthy and, drink a lot of water. There's always bottled water available for all of us. Yeah, so anyway, thank you. That's all I have to share. I'd like to call on our CEO, Dr. Rica, for our superintendent's report.
Welcome home, Emma.
Thank you.
So just brief bullet points, affiliation update. So we continue to await the revised version of the agreement, and we did talk about that earlier. Recently learned that the cause of the delay has been that the key members of the overlay team have been, all their attention and energy has been diverted to some other work that they've been doing. They've been doing a couple of other joint ventures, and both Both of those have now come to resolution and conclusion, and so everything's now on our work. So we expect to have something in hand in this next week, and then ready for our meeting in March when we come together for our next affiliation work study. In the meantime, we do have a face-to-face meeting with the overlay team between there. In our community, the influenza rates remain quite high, but they look like they're heading on a downward trend. So we'll see where this goes. Just the last couple of weeks, it's been starting to head downward. Internally, we maintain a readiness to care for anyone who's suspected of a communicable disease. So whether that be influenza, the measles, coronavirus, I bring that up only to say it's really not a threat, but if it should pop up for any reason or a concern about it, we already live in a state of readiness. There's a quarantine site, you may have already heard, that's being set up in North Bend. That will be completely overseen by King County Public Health Department, and they'll also have the responsibility to directly manage anyone there who may become symptomatic or concerning for actually developing the coronavirus. Public Health Department works out of UW Harborview, so we won't be in the line with that. The late part of January and here the early part of February have been our lowest swing bed census days for the 5 years that we've been here in the building.
Wow.
No one specific reason, several things probably contributing, but no one specific. We've been financially sustained during this time. The rapid growth of the reference lab work, so financially hanging in there. But active work is nonetheless occurring on an everyday basis to recover our census. We definitely want that back up. I do want to make sure that we publicly extend congratulations to Commissioner Carter. She completed her WISHA Healthcare Governance certification. That required her to accumulate 12 credit hours of education in healthcare governance in this past year. So she'll get that certification awarded to her in April of May. Anyway, and then as all of us at the table here know, earlier this afternoon we reviewed the community health needs assessment, and it demonstrated that we are a generally healthy community, but definitely pockets of need and opportunities there for us. So as this year commences forward, we'll use this information to inform us as to where our priorities need to lie, suggest opportunities to work in collaboration with other community-based groups, and try to work on these needs and close some of the gaps that showed up in that needs assessment. And then one of those community groups that we've consistently supported and worked in collaboration with is the Snoqualmie Valley Community Network. And we were one of the sponsors for their recent annual fundraising gala this last Saturday night, and Patrick and his wife represented us there. So they've already sent a note of appreciation for the bit of funding that we did, and they use our name and such. There was an exchange for that.
Are there any questions? All right, now we call on our General Counsel, Tonsky Hauser, Board Education on Robert's Rules Minders.
Thank you, Madam President and members of the board and staff. Tonight we're going to talk about the equivalence of terms in correct motions. Apparently, Mr. Robert wants to take us to task when we make incorrect motions, and they typically are surrounded around the areas of reports or information provided from committees. And I've noticed this board actually does a really good job in this area. That you don't make these mistakes, but I wanted to bring it to your attention that when you have an assembly's action in respect to board or committee reports, as you know, you're going to hear reports tonight. You're going to hear them from the, Finance Committee, the Medical Committee, and the Facilities Committee. Their contents, oftentimes the expression to adopt, accept, and agree to are all equivalent. That is, the text adopted becomes an effective statement. So what does that mean? Well, Robert tells us it's usually best to use the word adopt. However, since it's the least likely to be misunderstood, well, if that isn't as clear as mud, adopt, accept, or agree, what do you really want? He says a common error is to move that a report be received after it's been read. Apparently that's on the supposition that such a motion is necessary. It is not. It's not necessary at all. You don't have to move to receive the report. In fact, he says the motion is meaningless since the report has already been received. So don't move to receive it when you've already received it. Then he goes on to further chastise us and say that even before a report has been read, a motion to receive it is unnecessary if the time for its reception is established by the order of business. Because it's already been established, it's already in your agenda, it already says the report's going to be there. So he finally goes on one more time and says, not only should you be chastised, you should be told that it's dangerous. Another error, less common, but dangerous, is to move after the report's been read, or even before the reading, that it be accepted, when the actual intent is that of the mistaken motion to receive, as just explained, or of a legitimate motion to receive made before the report is read. If a motion to accept made under any circumstances adopted and given its proper interpretation, it implies the assembly has endorsed the complete report, which you haven't. So, you're not supposed to receive, you're not supposed to accept, and you're not supposed to adopt.
So what are we supposed to do?
Then what are you supposed to do?
Yeah.
That's the question. Well, and what you are supposed to do then is let the report be read, and then you are supposed to only take action if there is a motion as to the result of the report. And therein lies also in your agenda. That's why I said you're doing so well. You have under Finance Committee the report, but under that you have a subset, 1A, approval of warrants. That is an action item, and that is where you will make the motion. So you're doing this quite well, and I just wanted to bring that to your attention, because even, I normally come and tell you, you should do this, or do this, do that, you're doing this quite well. And I found out that Robert's Rules has been chastising us inappropriately, because we're doing it right. And to do it further right, I met with your president tonight, and so at the next meeting, we are going to talk to you instead of looking at specific trees in the forest, which we typically do. I've been coming to you now for 3 years and picking out some little piece out of that 1,400-page document, and I'm going to give you the big picture. So I'm going to show you the forest. So at the next meeting, we're going to give you a chart that says, this is Robert's Rules of Order on a chart. And then we can start picking out the trees again, because that's what we've been doing, is just moving from here to there to here to there. And we're going to try and put it in a big context to talk about what is a main motion, what's a subsidiary motion, and what is a privileged motion. Trying to put it all in context. Then you'll really be confused. No. Thank you for your time.
Thank you. Okay. Next on our agenda is the consent agenda. Approval of minutes for the regular meeting, January 9, 2020. Do I hear any motion to approve? Here it is. Counselor, is it applicable to be reading the minutes prior to the skip?
I make a motion to approve the
Okay.
minutes as typed out or drafted, so,
That's right.
and the consent agenda, I'd be more than happy to include the physician credentialing as well with that motion.
Do I hear a second?
I'll second it.
Any discussion? Okay, all those in favor?
Aye.
The ayes have it.
Excuse me, for clarification, is your motion for the consent agenda?
For the consent agenda, and it included both, I itemized both.
Physician,
Thank you.
physician credentialing as well. Okay, consent agenda approval of minutes and the physician credentialing. Okay, committee reports. This is an action requested as noted. We'll begin with Finance Committee.
All right. Well, I always try to look at just some of the report. I don't read the report. I don't think it's necessary because we all are very good readers, and I try to focus on things that are probably a little more important, and that should be focused on of common interest for all of the board members and the staff. Let's see here. We had a net loss for the month, and let's start with that. Have a few our patient days were down by about 19 or 20, 19 patient days. That's in acute and swing bed. And that is a net, if you recall, and I just always remind people about what we're getting paid per patient day. And for Medicare patients and Medicare Advantage patients, we're getting about $2,800 or $2,850 per patient day, somewhere around there. So if you multiply 2,800 times, let's just say 80% of those people, that's 16 patients, that's somewhere between $40,000 and $50,000, maybe closer to 50, less in inpatient revenue. Outpatient, we did wonderful. We were way up in almost every category, which again, I kind of really had a hard time, and I questioned, well, what's going on? Why aren't we, if our outpatient is doing so well, and we make money out of a lot of these lines, why aren't we making money? So there's more to it, and we'll go to the next page that I looked at. Well, in January, or December, we had a lot of turnover, and our salaries went up as a result of per diem. Usually that's about twice the salary almost, or 60% more wages for somebody coming on a contract basis, I would think, somewhere in that. So it was up about 9%. But I'm thinking that this year we have a little higher wages for folks, and it's going to be a lot easier to keep people. I'm smiling as I talk to Dr. Wickoff, and so we won't have as much turnover, right?
That would presume, that's making the presumption that we had staff leave because of wages? And,
No,
truly
I'm
it's
making that
not.
presumption, but I
Yeah,
mean,
yeah,
overall, we'll have less effect maybe
Right.
for this year.
Those that
That's-
left because of wages, you would expect they would not.
Yeah, so we should be a little better off in that category. Easier to hire people and good quality people that way, and have good staff. So hopefully, we'll come out ahead by the end of the year. So anyway, that was about, as you can see, and there's a line item that I have, and the variance was $129,000. So 129,000 and 40,000 on inpatient is $170,000 that we weren't planning on that month. So it's no wonder why we were down 68,000, because we were projected to have $34,000 net bottom line. So that's the biggest part of this. We had election expenses also come up in December from the primary, which was about 10,000. And
31,000.
I'm sorry, 31,000. So that's 31,000. And we did plan on the 31,000 for this year, but it's always in a monthly. It's only like 2,700 a month. We budgeted for our election, and not so. And we had one extra election this year because Joan retired, so we had a little more expense than we normally do, which was about $10,000 more expense. So those are the driving factors in a negative bottom line for the month. I'm assuming that January might, I think it's about the same as our inpatient has been about the same as it was in December. So it's probably going to be not too bad because we won't have those extra expenses. So we should be in a better position for January. There's a payer mix. We were looking at payer mix, and we're getting, if you recall, about November was about 85% Medicare and 2% supplemental plans that pay us the same but take 90 days to pay us. And so getting that to the point where in December we had a lot higher percentage of Medicare Advantage folks, and we're looking at our AR rising as a result, and our AR rose. And this has been a topic for quite some time, the AR. We're somewhere around, I thought 63 days or something like that. 60, yeah. So it's getting up to the point where we're gonna be doing something. We've been doing a lot of background searching and negotiating with HRG, which has been our primary contractor to administer this service. And it looks like we might be able to get a better deal from another agency, but we're still we might be like having them go back and forth and see what we can get between the two, I guess, and maybe get a really great deal. In any event, it's gonna cost us less, I know that, and there's gonna be some other benefits to having a different service or having the same service. It doesn't matter, and we're gonna be getting a little bit better deal to manage our AR. More as we progress through the next few months, I imagine on that. Okay. Let's see here. You might want to look at, finance is always so dry, I'm sorry. But one of the things that is really important for you to understand about why we did this hospital, and we're servicing a whole lot more people here, and we have lowered the debt. I want to make sure this is on the record of anybody that wants to listen to this. We have lowered the debt approximately $10 million, pretty close, or nine plus $million since we moved in here. And that will be lower and lower and lower as we go along. We'll have an opportunity to refinance here in about a year and a half.
Parts of it in a year and a
Yeah,
half.
a little bit of it. And then in 5 years.
In 5
In
years.
five,
the bond,
there's a
all of
7+%
it.
interest rate that we have on the 5-year. We should be able to do really well on that rate in 5 years. So even though our depreciation is going down, our write-off for our interest and depreciation is dwindling, meaning our contractual repayment or payment from Medicare is going to be going down. We should be able to increase or lower the rate that we have to pay on our bonds. So to be hopefully pretty close to when we lower the depreciation and the interest, and we get paid less per month, per patient or per patient day, we should be able to compensate for some of that. And if we increase our outpatient services as we look like we're doing, almost all of our outpatient service lines are up this year over budget. So that was the thing that everyone, I don't know if who was here with me, I know Kevin was here when we first started discussing what we needed to do with this hospital, is increase our outpatient services because they do actually make some money. So we're on track. We're below what we want to be on track, but we're on track. We're not falling off the hinges, so, or the rails, I should say. So anyway, that's kind of, the looking at it from a long distance and what you should be looking at and making sure you understand, so that none of this information is misinterpreted to the public, because things are going according to plan. So we start within all of our compliance. We're at 1.51, our requirement is 1.2 in the bond requirements. That should be in the packet. That was given. Days cash on that is 77, bond requirement is 60, I thought it was 72.
Yeah.
That is 72, you're right.
So I think he was was, you know what, I think he wanted it to be 77.
It did. We talked about 77 for next month possibly.
Well, next month.
Next month.
Cart before the
We
horse,
want
it'll
it
be
to-
77
I
next
We
hope.
want it to be 100 next month.
month. So, anyway, so that's it, unless you folks have any questions, I'd be more than happy to answer what I can.
I got a couple.
Okay.
Back on our, this document here. And you spoke of the salaries being actual, being higher than, and you talked about raises and such. I wanted to ask you, just to clarify, there's a $45,000 swing in our budget amount and actual on the supplies. I was wondering, is there, sometimes there's a piece of equipment we need that we need to buy, or we need to do some repairs on some, because that's a pretty, $45,000 from a percentage perspective is very substantial. I'm wondering if there's, you can speak to that, or either of you, anybody?
Well, I'm not sure, I just know that we've had more revenue this year than anticipated. And if you look at the budget, on supplies, we're over by 3%, about 85,000, which probably corresponds, my guess is, to the number of patients we've been seeing increase in outpatient. And our inpatient overall is probably at least budget, I would say it's right about at budget for the year for inpatient, really close. So because of our outpatient, remember we started up the lab line,
Yeah.
Which is
started
good.
up the sleep study.
Yeah.
And I think some of the expense probably is calculated in
Those are,
one of those lines for this month.
those are both
Buying some-
unbudgeted supply lines, yeah.
So, you,
That came in after the budget was set?
yeah.
Correct.
Right.
Okay,
So,
thank you.
looking at that, it makes total sense that we're up 3% overall. And, you know, we don't order something every month for each department. It's
Sure.
when necessary, so it's,
Yep.
it can be
Thank you.
10% one month and 1% the next. So.
Sure. Purchase services,
It looks good, it's,
Sound Medical Lab
yeah.
is, I'm glad you asked that question because I forgot to include it. Sound Medical Lab is the provider that's overseeing the lab testing. No,
No,
wait,
we do the testing. They're the customer facing.
that's right. They
client-facing
interface
side.
with the customers, bring us the customers, we do the lab testing. And so we have to share in whatever we bring in.
Correct.
So, let's say we bring $100,000 in, we would pay them X amount of dollars, I don't know what it is, percentage, what do you think?
It's 40,000.
So it would be like
It's a- we have a
40%.
60-40 split.
So that purchase services would go into that category, which is a
and there's an
new-
ROI in that.
Yeah.
Oh,
yeah.
yeah, it's pretty substantial.
Yeah.
And that maybe again came in after the budget.
It
was-
did come in on the budget. Part of that as well on the purchase services though was the unbudgeted increase in the HRG fees as well, which is why we started the renegotiating of
Okay.
that too. So that, even though HRG was budgeted, it was above what we thought, what we had anticipated what the budget
Sure.
was gonna be. And part of that is increased revenue because HRG, we reimburse them on revenue too. They get a percentage of
Sure.
revenue. So that's the reason why.
Right. And the last item I had was just the other, on an annualized, it was 11% deviation, and this particular month it was 86%. And I wonder if, again, there might
Where
be.
was that? What do you
The
think?
other.
Other.
And that's that 31,000 in, the.
37,000.
Primary.
Yeah, the total is 37,000,
Uh-huh.
31 of that is the, election.
The election
fees.
expense.
Because
Oh,
we
yeah,
had-
he talked about that.
Yeah,
That
and that's
goes
just
into
the
there.
primary election, we haven't gotten the bill yet for
Okay.
the actual election.
The number will change
That's gonna be another 31,000.
Right,
for the gym.
Thank you.
yeah.
Okay, are there any more questions? Of course, we also had that supplemental finance committee minutes as well, if you wanna go more into detail. Okay,
Thank you.
thank you.
So I think I would secretary do that, or do I after finance? Does secretary, does it matter?
It doesn't matter.
Okay.
No,
Well, I'm
it doesn't
gonna make the motion, because it's right after the finance meeting, meeting, or committee report, so. just
I would
so we
second
don't
that.
forget.
Okay, second.
Been moved and seconded.
All those in favor?
Aye.
Aye.
Okay, the ayes have it. Now, moving on as the medical committee, but before we start, I would like to, the two commissioners that are members of the medical committee, approve the draft that was, that we did not approve. So, make a motion, Commissioner Norris,
I'd like to approve the minutes from the medical committee.
I second.
We're both in favor.
We're both in favor, thank you. Okay, proceed.
Sorry, Val.
Just want to make sure we are legal here. Sorry.
I think we already heard some of this earlier today about the influenza, and influenza-like-ness continues through the local community. It is not at epidemic levels, but it is still significant in its incidence, which appear to be starting to slow down. And most recent report lists 62 deaths and 5 children in the state. Coronavirus, non-threat level was also discussed in assurance that training for anti-respiratory droplets spread illnesses is standard competency for our staff. Statewide MIPS and MU reporting will be completed by the month end. All reports to date are good and anticipate compliance in all regular measures. Transition to EPCS, which is electronic prescribing of controlled substances, continues to move forward with anticipated full compliance among all prescribers in our system by mid-year. And I think there's a lot of attention to this, particularly when you have the abuse that goes on with medications, and other hospitals and everybody are trying to keep track of, if you go to Overlake and you get this medication, and then you come to Snoqualmie and you want the same medication for the same headache, they're gonna look and see you've already been treated and you're not gonna get it. So, and we have had in the past, a couple of individuals that have tried to do that and have gotten pretty angry at our system when we don't do what they want. So it's important for us. Nursing Practice Committee implementation work continues. Charter has been drafted and the committee now is to be seated. Annual skills days completed in January. All but 6 nursing staff completed a session. Let's see, emergency budget was 10.8. January 2020 visits are 10.8 per day, and in January 2020 visits, I don't know why that's
Year to date.
Year to date. They're
That's
both
year to date.
Yeah, year to date is 10.8. Transition to new telestroke video platform in January without difficulty, immediately put into use, which is pretty impressive. ED Psych Hold Court Evaluator contract now in effect. Workforce safety continues to be a focal point, especially in the ED. Snoqualmie Police have been excellent partners, and the security service engaged with our annual risk review as well. Patient transition service, redesigning intake and discharge workflows under our new team with focus on excellence, especially in the discharge process, so that it doesn't slow down and it's smooth. In fact, as a professional, discharge is really important that you get things right. Then you're more successful at home when the patient goes home. Pharmacy, antimicrobial, stewardship. Reporting was briefly interrupted while pharmacy was low-staffed. Reporting now is recovered. And Windows upgrade happened the day that we had our meeting. Reference lab growth has been so much swifter than anticipated that new workflows are now required for efficiency and timely sample and results management. Medicare annual wellness visit nurse-driven program reviewed, started in December, well received by patients. Chronic care management program reviewed, implemented in early 2019. More rapid growth recent months with addition of RN to clinic staff. Value-based contracts pended to March due to time, and I'm exploring an opportunity to reopen the women's clinic as an extension of CRMSC. Initial privileges to provisional status, you can see the list of physicians.
We have already
Already
done
did
that.
Oh, good, then we're done. Is there any questions? Of medical committee, that would be both Emma and myself, and Dr. and Karen. Hearing none, Madam Chair, we're done.
Okay. Next, facilities committee. Who is going to give the report? Commissioner,
I suppose.
Yeah.
I see I'm chair, so.
Yeah.
We had a great meeting. It was really interesting. It was interesting myself sitting in on the facilities committee, having been gone for 4 years and having sat off and on it for 9 years prior to that. And in the context of watching our team and how they conduct themselves today relative to how they did more than 13 years ago. And my exposure to them, I was really impressed. It was really good. Not that it was bad before, but improvement continues to follow. New business, maintenance issues, none to report, facility usage. Below is a list of community room uses for February 2020. As you can see there, the Boy Scouts, the Encompass, the Care Point, Snoqualmie, Daisy Girl Scouts. I think that's really important that we continue to move the dial with regards to accessibility of our tax-funded
Yes.
property, our facility that we have.
And
here.
Daisy girls were on their way in as we were on our way out of that very room today.
Isn't that great? Yeah, it's fantastic. Environment of care, emergency management, working with safety committee on 2020 risk assessment. Outcomes will be reported to the committee once the assessment is completed. Inclement weather required emergency preparedness for facility staff and patients. We spent some time talking about the outside of the front door, just again the awareness of safety for our patients and people that patronize our facility here. There were no facility or personal issues encountered. Some staff stayed on site as needed to assure continuity of care. Clinics remained open on reduced schedules. There was a good management of walkways, parking lot, and driveways, as I mentioned. There was a lack of attention to sidewalks and parking lots at the Ridge Clinic, and this was reviewed with the property management company, and because we are a tenant there. Fire safety management, last quarter fire drills 2 were completed by December 31st, which put us in full compliance. The 2020 fire system certifications are scheduled for January 27th and 28th. Hazardous materials, waste management, a rapicide neutralization audit. That sounds like that's something from mice. Huh?
What is rapicide?
What is that?
Cleaning products.
Very good.
Oh,
Neutralization audit has been conducted this month with no concerns. Medical equipment management, no report. Physical plant. Repairs on rehab department doors are scheduled for the week of January 20th. This was delayed due to the recent inclement weather. The parts have been obtained and ready for the service called to happen. Safe patient handling, no report. Safety management, no report. Security management, no report. Utilities management, still working on power quality issues. Recommendations have been made by the consultant, but we are waiting for a final written report. That'll be interesting from a technology perspective, I think, from a consistent feed of power in all of our technical sensitive equipment that we have on site. The facilities committee will now meet on the 4th Wednesday of each month at noon to 1 p.m. Due to the recent snow, a tree is now leaning against Building 1 on East Campus. We are working with a tree service vendor to remove the tree. The building is not in use, however. Our next meeting is scheduled for February 26th at 12 noon, East-West Conference. Would you have any additional comments?
No, I thought that was a wonderful summary.
Why, thank you. Any questions? Hearing none? Do we need approval?
no, doesn't need to be. No, it's not. Okay, thank you. Thank you,
welcome.
commissioners. Old business, introduction and discussion, none. So we're moving to the new business. This is just introduction and discussion. We will not vote as we discuss the resolution number 661, 0220-surplus equipment. Okay. So, yes, please.
So as you know, any equipment that is no longer in use or is no longer usable needs to come through the surplusing process. And so there are 3 items on the very back of the resolution that need to head out the door. So it's two TV screens that are beyond the end of life, and then the same thing for a medical refrigerator freezer, which also is some aspects of it have failed, and so we can no longer have it in service. It's not serviceable, and in its current state, we can't have it as a medical grade freezer.
Are we replacing these 3?
Just have to.
Yes,
Or already have?
it's already done. They'd actually held on to their refrigerator freezer thinking that an opportunity to use it might come up, but it's just an eyesore taking up space.
Oh, but the parts can be sold. They're stolen.
Oh, no, they'll do, once you've surplused it,
Yeah?
then they start trying to be creative about,
Yeah,
do you part it out, do you sell it, do you dump it, you try not to dump it. There's lots of mission efforts,
Right.
depending on the item.
Right.
Yeah, so they're they become as productive as they can with it.
Yeah.
How did 2 TVs fail or at the
Yeah,
same
42
time period?
inch.
or-
Oh, we have
How
we
old is it?
moved in here and bought a huge number of televisions, and so they're all kind of hitting the end of their life. Many of them are on 24 hours a day. The ones that are in public areas, because we use them as display monitors. We don't use them just for televisions. We use them as display
And
monitors.
the cost has come down so dramatically.
Exactly. It has.
Uh,
It absolutely has.
So do we need a motion to?
Oh, okay, so before we do, we have to, public comment. We don't have any public comment, so we'll move to action items to vote on resolution number 661-0220, surplus equipment. Do I hear a motion?
So moved.
All those in-
I'll second it.
Okay, all those in favor?
Aye.
The ayes have it. For the good of the order, commissioner comment, each commissioner shall have 1 comment period limited to 3 minutes.
We're not
Commissioner-
starting with me.
Commissioner Spiders. I'll start from
I have
Commissioner
no comments. I
Spiders.
think my comments at our work study were more than enough.
Okay. How about Commissioner Carter?
Welcome back, President Herron. Thank you
Thank
for your
you.
public service. Thank you to the board for indulging my absence next month. I will be on a business trip. I cannot change the dates, so I will not be here for the March meeting. Thanks, everybody.
Commissioner Carter, you could call in.
I cannot, I will be en route. I'm gonna be on an airplane.
Then you won't call in.
Sorry.
But I just wanted
But
the
good to know.
commissioners to know, the
Okay.
RCWs allow you to call in and participate by phone, so long as that you can hear and be heard, and you have been provided the agenda materials prior to the meeting. So
Okay.
anytime, sometimes it doesn't work. I know that we've tried it with Commissioner Spikers in the past, and
Yeah.
the technology doesn't always work, but at least the opportunity is there.
Okay, thank you. No, I should be, time zones, forget it now. I'll be in the air.
Well,
Thank
good.
you, though.
Good for you.
I would like to just simply offer a congratulatory, just a well wish for everybody here with your significant others, should you be so fortunate, that you have a blessed Valentine's Day.
Oh,
That's nice.
thank you.
You
That's
too.
all I have to say. I will. Thank you.
Commissioner Norris?
I'm glad there's no snow on the ground. I am.
Yeah.
I'm glad there's no snow. Makes life a little bit easier, so that's fine.
And I'm thankful for everyone to give me the opportunity to participate on a medical mission and attend the World Peace Summit. And I'm thankful that I was not a casualty of coronavirus.
I'm glad you weren't
Thank
too.
you, and I'm very happy to be back. Okay, now we can go on the vote. Oh, I'm sorry. That's it. Next scheduled meetings, work study, Wednesday, February 26, 2026, 30 p.m., North-South Conference Room. Affiliation work study, Thursday, March 12, 2020, 4:30 to 6 p.m., East-West Conference Room. And monthly business meeting, Thursday, March 12, 2020, 6:30 p.m., North-South Conference Room. And this will be as is, with an excuse for Commissioner Carter, hopefully be able to participate on a conference call.
So may I ask a question? We have Wednesday, February 26, 2020, 6:30, so we're not doing any work study before it. It says work study, February 26, and then it says 6:30.
You're right,
That is the Wednesday work.
that's the Wednesday work study.
Okay, so, and
And
then no board
affiliation.
meeting.
Correct, that's the
one
Wednesday
just-
work study that's by itself.
Okay, so
And
it's a
then
four,
on Thursdays is when we have
Okay.
the work study followed by board meeting.
okay.
I might not be able to do a finance meeting on Wednesday the 4th. I will be in Loretto.
Wednesday,
Sweet.
Laredo?
Loretto.
I hope nobody's
Mexico.
down there with a gun.
that's Wednesday,
I just
February
saw.
26th.
We're going there for a wedding.
Finance.
Friend's
Yeah,
daughter.
That's lovely.
Our finance meeting. Sounds good. I thought we do it every Tuesday.
No, it's north of Cabo, it's up the Baja Peninsula up at the top,
So, do you want to resolve that?
probably less than 100 miles from the border.
Hey, Bill, excuse me,
Okay, we will resolve that after the meeting.
question,
We
if
have
I
to
may.
change it. I'll let you guys know.
Do we have a facilities meeting on the 26th? Okay, so that is there.
That's also,
And then we also have another meeting just a few hours later. Is that right? I wonder if it's possible to consolidate, compress that up so we don't have to go and come and go.
Which one are you talking about?
The
Well, we
Wednesday.
have the
Wednesday,
facilities at 12 to 1, and then we only do return back here 5 hours
Take a
later.
look at that and then.
9th through 11th.
Okay,
thanks
that
for
would
the
be
notes.
appreciated if we could.
Okay, any other schedule issues?
I make a motion that we adjourn.
Okay, meeting's adjourned.
Well, wait, there wasn't a
We
second.
don't
No,
need a
you
second.
don't have to.
We don't need a
No.
second.
Oh,
We don't need a
If
second.
the president doesn't hear any objection after a pause, then she can adjourn the meeting.